Wednesday, November 2nd, 2022 meeting of the Health and Human Services Committee to order. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Moving on to item number 3, public comment. I did not have anyone approach me. And Kelly, did you have anybody sign up for public comment? No? Okay. Item number 4, approval of the October 5th, 2022 Health and Human Services Committee meeting minutes. Those were in your packet. Motion by Arstead, second by Covelli. Is there any comments, discussion? All right, seeing none, all those in favor say aye. Aye. Opposed? Right, motion carries unanimously. Let's see here. Item number 5, policy issues, discussion, and potential committee determination. 5A, resolution to maintain a license for 160 beds at Mount View Care Center. This topic came up to our committee, I think it was like a year ago we talked about it, and most of these members are new. I think Donna's the only one returning and she's not here today. So we have Morton Jarrett from North Central Healthcare, who I think can provide us a little background and let us know what's going on with that now. Working. Well, they work on that. And if you wish to read more about when we talked about this last year, it would have been in the October and November meeting minutes for Health and Human Services from 2021.
All right, we have the microphone working now. My name is Jarrett Nickel. I'm the Managing Director of Nursing Homes and Residential for North Central Healthcare. I was with you guys, I believe it was November of 2021, to ask for a bed reserve. So for familiarity, Mount View Care Center is the skilled nursing facility on the North Central Healthcare campus. That facility at this time is licensed for 188 beds. What that means is that's the capacity, so the most amount of residents that we could care for is 188 at this time. In November, this committee had approved putting 34 of those beds into what's called a construction reserve. So what that does for us is we don't have to pay tax on those beds. What the state does is it requires you to pay a bed tax regardless of ownership for those beds to keep those beds. So this committee approved to put 34 into reserve to basically save some financial dollars for us. So currently we operate with a license of 154. The significance of why I'm coming back to this committee a year later is you're only allowed to put those beds into reserve for 12 months. So those beds are now expiring from that construction reserve, and we have to make a decision on terminating those beds permanently. And the significance behind the 160 bed number is that is the number of physical beds that we'll be left with at the end of the construction project, which Mort McBain will talk to you guys on 7A about. But 160 beds is what we'll actually physically have at the end of the day. That is, again, the capacity. We budget for 2023 at 128 residents. So we have about 32 extra beds even at that 160. I know that there's been questions in the past with COVID impact and things such as that. We have seen our census grow. We were at 113 to start the year. We now sit around that 125 to 30 range. So we believe keeping those extra 32 will be valuable as we continue that recovery. But we, again, won't have physically 188 beds.
Thank you. With the 32 extra kind of from what was budgeted for, we paying the tax on those, correct, even though they're not in use?
Correct.
Okay. Right. What other questions are there for Jarrett? Go ahead, Ron.
Thank you, Madam Chair. What are the taxes on those beds? How much are they?
Yeah, so for those beds, it's right around $56,000 annually.
Is this covered under the North Central budget, or is this brought to our committee to do what?
Yeah, it's under the North Central Healthcare budget, but with the new Tri-County agreement, because it's a direct care service, it's only offered in Marathon County, it goes to this committee for decision making.
Okay, and what kind of decision making do we need to do?
To approve a resolution to move from 188 licensed beds to 160 licensed beds.
Okay, thank you.
Are there any other questions? Did you, oh, here it is. No, did you guys have a resolution prepared?
Madam Chair, there is a resolution, I believe it's in the county board packet, but I don't see that it's in this packet.
Okay.
I can try to get it on the screen for folks to take a look at.
I think that would be helpful if you were able to do that.
Absolutely.
I'm pulling it up right now, too. I don't know if it is in there either. While they work on pulling up that resolution, at what point can you reevaluate how many beds are needed? So if we're, you budgeted for a certain amount, we're kind of licensing over that amount, what point do you reevaluate if we actually need that amount?
Yeah, so we evaluate our bed count every year. That's something that we do when we're looking at our budget into the following year. So typically, we try and do that around the May time period. This year, with some of the transition in the organization, it's a little bit delayed, so that's why it came up a little bit faster than what would have been anticipated. But around May, I would say, is when we'll have projected numbers for 2024 moving forward.
Okay, and is there a penalty or is it okay for every year to change up and down how many beds you license?
You can't change up. That's the one key to this, is you can only go down. The state at this time is not allowing more licensed beds to be added. So, for example, if the resolution was approved to remove those 28 beds, we can't go tomorrow and say we want those 28 beds back. Right now, there's a freeze across the entire state as they're trying to right-size skilled nursing facilities. There is word that that'll likely be removed at some point, as there's been a lot of closures throughout the state in the past 5 to 6 years.
Okay, but we wouldn't have the physical space anyway for more.
Correct.
Okay.
So the state comes in every year and evaluates it, so we'd have to prove to them that we have the physical space. You can't hold more beds than you have physical space for.
Okay, great, thank you. They're still working on the resolution. Are there any other questions? Okay, I think before we vote, I would like to see a resolution. So do you want us to wait on you, or would you like us to move forward with the agenda and we can circle back?
Oh, here it is.
Okay. We will wait then. Oh, is this it? Thank you, Kim.
I just printed it off.
Mike, would you be able to email that to Allison and Dennis as well? Thank you. I'm just going to give a few minutes for everybody to take a look at that, and then if there are other questions, we can continue. Go ahead, Supervisor Cavelli.
Thank you, Madam Chair. So I have a question. It looks like you currently maintain 188 nursing home beds. Is that correct? And that's what you're licensed for?
Correct. Correct. Yeah, it's 188 beds, and then 34 in reserve. That 154 is the current number.
Okay, and you're looking at reducing that to 160?
Correct.
So the 160 beds would be the beds that we're taxed on?
Correct.
Okay, so we're actually reducing the amount from previous year from
Correct.
188 to 160. Okay, thank you.
Does anybody else have any questions now you have a chance to review the resolution? Okay, so what they are looking for from us today is passing this resolution so we can change the licensing to 160 beds. So do we have a motion?
I'll make a motion.
Okay, motion by Cavelli. Is there a second? Second by Niemeyer. Any further discussion? All those in favor say aye. Aye.
Aye.
Opposed? Right, none opposed. Motion carries. Thank you. Thank you, guys. We'll move on to item number 6, operational functions required by statute, ordinance, or resolution. 6A, approval of the 2023 Elderly and Disabled Transportation 8521 grant application. And we have Dave Mack with us from CPZ today, who is going to go over that grant and application.
Thank you. Thanks, everybody. Again, I'm Dave Mack from Conservation Planning Zoning, CPZ, the planning manager there. Spend a lot of my time doing transportation planning, which is what I'm going to talk to you a little bit about today. Today, I'm bringing to you an application for funding from the Department of Transportation for their Specialized Transportation Assistance Program, or the Elderly and Disabled Transportation Program. This is a statewide grant program. All of the states, or all of the counties in the state, apply for funds to provide rides for those that are elderly and have disabilities. This state grant program is governed by state statutes. It's number 85.21, so everybody affectionately calls it the 8521 program, creatively. It also then also has some administrative code language in Transportation 2.10 that governs this. It's an interesting grant program for those that are involved in grant writing and grant being involved, where this particular program has everything scripted in statutes on how it's supposed to work. Most of the time you don't have to go all the way through the county board for approval just to apply for funding, but that's the case in this particular program. They do establish the fundings for each county in August, and so we know how much money we will be receiving when we apply. And so we have to go through the hoops to get that application in. So in your packet for you today is the application that we're going to be submitting with approvals by you and the board. It needs to be in by the end of the year. So we're a little bit ahead, which is great. There is a resolution on page 2 of the packet that I submitted for the board to take a look at. Just a little bit about the whole program, because I think some of you may be new to this. With some of our new board members this year. With this program, they've created every county needs to create a committee, and we have a transportation coordinating committee that is part of our structure that oversees the operation of these funds, and is then needs to report to this particular group for their work that they do as part of our county structure. The membership of the committee is also scripted in the statutes, and so we have a number of county board members on the committee, as well as some other members of the community that are on the committee as well, that to take a look at providing the rides for people and making decisions about the funding. Right now, the county has under contract 2 entities that provide rides for us. One is the city's Metro Ride bus program, and the other is North Central Healthcare, their transportation program. So we provide funds for them. In the application, you'll see that there's 3 different programs that we establish. One is North Central, one is Metro, and then the other one is CPZ itself. We take a few dollars out of the grant every year to administer the program and to staff the committee, the TCC committee. For 2023, we'll be applying for $364,629. That needs to be matched with 20% funds from the county, which is already budgeted for. That's $72,926 for a grand total of $437,555, if I remember right. Let's see. Try to see what else I got for my notes. So when North Central provides rides, they provide those rides to people with disabilities throughout the whole county, and that's for people that are over 60 and that can't use the Metro Ride service in the city for whatever reason, or they live outside the city of Wausau. Metro Ride only provides rides within the city of Wausau with their program, and so people can choose, if they will, which service they'd like to take, depending on what type of vehicles they're able to be using, whether they want to choose Metro Ride service or North Central Healthcare service inside the city of Wausau. As part of this whole program, as like I said, scripted by statute, a public hearing needs to take place regarding the application, and that took place last week on the 26th of October. Unfortunately, no comments were taken at that time from the public. And as you see going through the application, there is a page that describes something called the trust fund. Anytime that we do not spend all of our money in the grant in an annual basis, we have the ability to put the money into a trust fund and keep it for ourselves here instead of giving that money back to the state. Over the last few years, we have, because of a lot of rides not being used during COVID, our current balance of the trust fund is about $116,000. That money can only be used for capital purchases, and so right now in the 23 application, we're looking to spend about $110,000 to buy another vehicle for North Central Healthcare. That's a lift operated vehicle or a wheelchair lift vehicle. And they're not very cheap anymore, so we're looking at $110,000 for just one vehicle. And so today, I'm asking you for your approval. The Transportation Coordinating Committee has endorsed this and approves the application and sending it to you for your approval to take to the county board. So with that, I'll be more than happy to answer any questions.
Thank you, Dave. Are there any other questions for him regarding this grant application? No, no questions? Go ahead, Supervisor Arstead.
It's my turn. What is the? It's green. Okay, here we go. What is the total of the grant that you're asking?
The total grant itself?
Yes.
We will be receiving, boy, now I gotta find my numbers here. I have it here somewhere. $364,629 is the amount we'll receive from the state.
And then you've got the trust fund at $110,000.
Correct.
And what you're asking today is the county funds, $72,926.
Actually, we're just asking to apply for the
Okay.
grant
Okay.
from the state, yeah.
Thank you.
Okay, are there any other questions? Okay, seeing none, then do we have a motion to approve the resolution for the 2023 Elderly and Disabled Transportation Application 8521? Motion by Kfelli, second by Niemeyer. Is there any further discussion? All right, seeing none, all those in favor say aye. Aye.
Aye.
Aye.
Opposed? All right, none opposed. Motion carries. Thank you, Dave. Okay, moving on to item number 7, educational presentations and committee discussion. 7A, North Central Healthcare Programs and Operating Update, including WASA campus renovations and relocation of adult day services. And we have Morton and Jared again to talk to us about that.
Morton Chair Show.
Thank you.
Madam Chair, is it okay if we sit here perhaps? Be a little
Yes.
closer to the committee?
It is. Is your microphone on?
Yes. Thank you. Well, thank you for having us here today. We've got a couple of items on there, but it's actually a rather broad agenda item, and so I'm going to assume that it's okay to talk about North Central in a general format. The agenda says that
I think that's acceptable since the item is North Central Healthcare Programs and Operating Update.
right.
I would agree.
Okay, thank you. So let me just refer to the org chart, and I wanted to give you just a little overview of some changes recently at North Central Healthcare in terms of the organizational structure, specifically related to the management of North Central Healthcare. You probably don't remember all the details from before, but this structure was created in the last couple of months, actually, after a lot of discussion with the executive committee at North Central. When we went through the recruitment process for a new CEO, we were not successful in our recruitment. We had a really good candidate, but when all the negotiations were done, he did not accept our offer. But he did come back at our request to act as a consultant to us. He recommended that we revisit our org structure and said, essentially, you need to kind of get your org structure reset before you start over and try to hire a CEO. Because there's not a lot of clarity to the way this organization is put together in terms of the management. So we went through a pretty intense discussion with the committee and with the senior managers, and this is what we came up with. This of course just illustrates the management structure at North Central, and under each of these groupings there's hundreds of employees. There's 850 employees at North Central, so it's a big organization. And I'll just go through the significant changes that were made to this structure. And mostly I'm talking about the senior management line, starting from the left. The managing director of finance/administration, that's Gary Olson. I think some of you know Gary. He was our finance director, new finance director. He's now director of finance and administration, and we gave him some other functions as well as the finance, including HR. Then we have the compliance officer, which is a very unique kind of position in a healthcare organization. Healthcare organizations like ours are, I should say, inundated almost regularly with multiple regulations regarding healthcare operations. Just yesterday, it was announced that we had an unannounced, unscheduled visitor from one of the state regulatory agencies responding to a complaint. And that triggers an unannounced inspection from a state inspector in the nursing home. That one, fortunately, was found to have no substance. In other words, it was not really true what was claimed. So we were given a clean bill of health. But this happens regularly in the nursing homes and the hospital. You can't believe how much we're regulated. And in order to keep abreast of all those regulations and protocols, we have to have a full-time compliance officer who makes sure that everybody in the organization is following all the regulations that come down constantly from the state and federal government. And so she has a very critical function. In fact, her reporting relationship, you'll notice on this chart, she has a dual reporting relationship, not only to the executive director, like the other managers do, but she has a direct reporting relationship to the executive committee. And there's a very specific purpose for that, and that is that's to protect and preserve her ability to go right to the committee with any issues that she sees with management. It's sort of like a whistleblower protection almost. And that's a very necessary function in an organization like ours. We have to know that the person who's responsible for all these state and federal compliance issues has a direct access to the top authority in the organization. So that's why Jennifer has that direct reporting line. The next position over is Managing Director of Community Programs. This is a critical position. This is a new position for us, although we had a previously position that was similar to this, but this position is essentially new the way it's organized on the chart. This is the grouping of programs that are most have most interest to the county. These are where all your 5142 programs are administered under this managing director. So this is the person that's key to the success of the 3 counties under the Tri-County Agreement in meeting their needs. And that position right now is vacant, and we're recruiting. In fact, tomorrow we're interviewing some applicants for that position tomorrow. And we hope to have one of those applicants will become our new Managing Director of Community Programs. Then moving across to the right, we still have a Chief Medical Officer. I think you've met Dr. Guthrow from before. He still has that consulting role for all the clinical programs that we operate. And then off to the right, we have the 3rd Managing Director, and that's nursing homes and residential, and that's Jarrett, who's with us today. Previously, if you may not remember our previous organization chart, but all of these programs were all under the executive director and the chief operating officer. There was no specific groupings. Now we've arranged it that we have essentially 4 senior directors. We call them managing directors, including the compliance officer and the chief medical officer. So this is a little bit different in terms of who reports to who. The other critical part of this chart, and this is important for you to know as a county organization, off to the right of the executive committee, it was recommended by our consultant that we set up something that he called the Human Services Leadership Team. This is a key part that we've changed in the organization. This leadership team is comprised of 6 individuals. 3 of them are the managing directors that you see on the line below. The other 3 are all of the 3 social services directors in each of the counties that we serve. That's a significant change. The reason for setting up that committee is to reassure the counties that we serve, Lincoln, Langlade, and Marathon, that we are continually evaluating and assessing how we meet the needs of the counties. And we do that by meeting regularly with social services directors from each of the counties, with our key managers. And we think that's going to make a significant difference in how we serve the counties. And that's been an issue for some time. On both sides, it's kind of an issue. This, we think, will bring those concerns together under one leadership team and help us to resolve some of these issues that have been going for years, actually, in terms of lack of communication and, for example, law enforcement not understanding when can we bring, clients to North Central? Can they refuse? Can they turn us down? What are our rights? With your 3 social services directors on this team, those issues are going to get resolved fairly quickly. So we think this is a good way to move forward for North Central. So that's kind of the overview of where we're going as an organization. And it directly affects you and your services that you need from North Central. And it helps us to meet your needs. So if there are any questions on the organization charter, I'll be glad to talk about that. It's a lot to take in. It took us a long time to come up with this, but we think this is a good way to move forward in the future. And it definitely ups the ante on relationships between the county and North Central in terms of who we are and who we serve. So this is how we're moving forward in the organization. Then specifically on the agenda, we want to talk a little bit about 2 things. I want to give you a little update on the campus renovation that's been going on and is still going on and will be going on until the end of 2023, actually. But if you look on the handout that we gave you, if you look actually, let's see, probably the best way to do it is start on the second page. That's the one that says North Central Healthcare Addition and Remodel. That's the project summary. That just gives you kind of a summary of all of the components of the remodel. And it's a very short list, but it's a huge project. And I know you probably don't understand some of these terms, but that's all of the major components of North Central in terms of facilities that we are remodeling with the dates. Then going back to the first page, which is Wausau Campus Renovation Update, dated today, that's just a summary of where we are now with each of those components, starting with Lakeview parking lot, very important part of the organization. We just basically got the parking lot finished. It's now opened again. That was a bit of a hassle when we had to have people not use the main entrance, go around the back and find out the new entrance. And when we have people being dropped off and people in wheelchairs, it's a real hassle when you can't access the main entrance. Anyway, that challenge is finished now. We got the parking lot opened up. Now we have the behavioral health wing, that's D wing. That's been open for a few months. We're still working on the loading dock, and the rest of the D wing will be completed by the end of November. Then just going on in the interest of time, we've got the old Mountain View building. Maybe some of you have been in that. Where we've started the renovations in that building, and that'll be completely remodeled for a different purpose because we have a new nursing home, it's the tower, and that's a 4-story nursing home, beautiful building. But we're remodeling the old part to accommodate the administration, the pharmacy, outpatient services, community treatment, and HR and finance and all those administrative functions. The second floor will still be nursing home residents until we're completed with the whole project. And then one significant item actually is that we have changed our operating address our legal address. Before it was all, the address really didn't relate to the street location. And the reason we've updated this is for emergency access. When we have ambulances or emergency personnel rolling up, you know, they need to know exactly where in that campus that they're going. It's a big campus, and you can waste a lot of time if you don't know where you're going. So we've addressed the main entrance, and then that will be 2400 Marshall Street. And then 1100 Lakeview Drive is our actually that's our main address. But deliveries and so on, they're going to be at 2400 Marshall Street. But this is happening now. We've got these addressed now, and the signage is being put together. And the last thing, which is mostly of interest to the residents in the neighborhood, is that they wanted to know when we're going to get our green space back. Well, that'll happen at the end of 2023, when everything's all done, and we put all the grass back and set it all up nicely, so they've got a nice green space and green fields instead of all the construction material. And if the weather permits, we'll be done with that at the end of 23. If not, we'll have to wait till spring to put all the landscaping in. So that's a very brief update of where we are with the project anyway. Any questions on that? We'll be glad to answer those.
Thank you, Mort. This is incredibly informative. I think one question that I had relating to the org chart is you mentioned the hunt for an executive director, didn't find one. So now that the org chart has been revamped, will that be posted again? Is that?
Yes.
Okay.
We're going to do it a little bit differently this time. Because we have a new position, this managing director of community programs, we're recruiting for that first. And then when that is filled, then we will begin the recruitment for a new executive director. And we'll be able to say, look, this is how the organization looks. It's all fully staffed, and this is what you'll be working with. We thought about maybe we should hire the executive director first, and they could help us choose. We thought, no, let's just have the organization put together the way we think it should be. Then we'll go out and recruit for a director. The philosophy that we're following there was voiced by one of the social services directors that we talked to. And after a lot of discussion, talking about how do we reorganize this thing, he said, and I remember this quote, he said, first you organize yourself the way you're supposed to be organized. Then you recruit to that organization. Rather than bringing somebody in and saying, you know, we're trying to reorganize ourselves, how do we do that? He said, reorganize yourselves and set yourself up with your management team the way you think it ought to be. Then you recruit a person to take charge of that organization. And I thought that makes perfect sense. So that's what we're doing. And like I said, we're in the process of recruiting for that key managing director. And hopefully that'll be wrapped up in a week or two. And then we'll begin the recruitment for the executive director.
Thank you. Are there any other questions regarding the org chart or the construction update? No? Okay, then I think we can move on to relocation of adult day services.
Sure. So this is the other formal item on the agenda. And I want to talk just a little bit about ADS, and Jarrett can jump in if there are questions also. ADS stands for Adult Day Services, and I know none of you are familiar with what that is. We used to call it adult daycare. You know, that was the kind of a nickname for it. And we've kind of gotten away from that name. You know, it's not considered a very dignified name, adult daycare. So we call it adult day services. These are people who are cognitively and physically disabled, who cannot work. And all of them are probably SSI, you know, candidates, or they're on SSI, which means they're automatically eligible for Medicaid. for Badger Care or whatever. These are people who need to be taken care of in the daytime. Just as you send your kids to daycare because they need somebody to take care of them, these are adults who need to be taken care of. The ratio of staff to clients in this program is 8-to-1. So we have eight clients, and we have a staff member that takes care of these folks, 8 of these individuals. And right now they're on the campus, of course. They've been there for many years. And we're actually going to move that program into the clubhouse. That wasn't always our plan, but it's turned out to be actually a pretty good plan. We're working at Clubhouse right now to set it up to accommodate this program, this adult day services program. We're going to have, I don't know if you remember the numbers, but when we were looking at Clubhouse and the number of people who were there on a regular basis at the same time rarely exceeded 12 to 15. In fact, when we did a census for lunch program, sometimes it was as few as 6 or 7 people that were there for lunch. We're going to be having 70 people at times in that program at the clubhouse. We're going to use all three spaces. That means the upstairs and the downstairs, which was not used much by Clubhouse. They really didn't need the downstairs, but we do. We have some clients that are quite mobile, and they can go up and down the stairs. So we'll have about 70 clients in our ADS program in the Clubhouse facility. We have one private pay, but very rarely do you get private pay folks in ADS. Most of them are, all of them in fact, are Medicaid. That's how we get reimbursed for our staff, is these folks are eligible for adult day services. And so we have to have a place. The only other challenge we're having with that location, and this has gotten resolved in the last day or two, we were concerned because 3rd Avenue, which is quite a busy avenue, we were a little worried about arrival time and departure time for all these clients. Most of them, a good share of them, and we come on our paratransit buses, those smaller buses that you see, the white buses. We pick up around all over town and bring clients to the center. But there are some families that drop their family member off there, and they drop them off in the morning and they pick them up in the afternoon. But the good thing is about that is that we don't have drop off till 8:30 in the morning, which is a little past the typical rush hour. And our program closes at 3 in the afternoon, so people are picking up their family members between 2:30 and 3. So that's just before the real traffic starts on 3rd. So we think it's going to work out okay. We're hoping we've got to do some training with the family that comes to drop off their people, so that we don't get traffic jams and mess up on 3rd Avenue. But we think it's going to work out okay. And we had the fire marshal over the other day, and he thought it was fine the way it was all set up. So we're planning to move in with ADS on November 15th. That's our official start date. And right now we've got all our crew over there cleaning up and doing a little fixing up, getting ready for our program. And I think it's going to be a good place for them. But change is hard, and some people may not like it at first, but we think it's going to be a good situation for our ADS program. So, questions on any of that?
Thank you, Madam Chair. Thank you, Mort. I had a current client of the program, their parents, get a hold of me, and some of the concerns that I think you may have addressed today, I'm not sure if they contacted you or not. I can forward the email if you'd like, is parking. The current parking lot is limited. Will it have enough space to not only allow staff to park, but also allow enough space for the handicap buses to pull in, load clients, turn around, and exit? So that was one question. Are there adequate windows? Will the clients be kept in a building with no natural light or ability to enjoy the outdoors? This can be an issue for depression, anxiety for some. And I've been to the facility, and there are windows in there, and I think there's a lot of natural light that comes in. As far as the outdoors, I'm not sure how that works. Because their space is limited with outdoor space at that facility. Bathrooms, will there be proper adaptive bathrooms for changing individuals in wheelchairs or private space for changing individuals who require Hoyer lifts? And will there be enough bathrooms for multiple individuals who need to use the bathroom at the same time?
Right.
And then another question was kitchen. Is there going to be a kitchen space for staff to hear or help prepare meals? And I've been there, and I know there is kitchen space. The use of the NCHC swimming pool. Will clients be able to safely be transported back to NCHC to use the swimming pool? And then open visibility. Will the space allow staff to be able to easily monitor all clients while also providing some private space when needed for individual therapies and behavioral issues? And I believe there was some private space there last time I was there. So, if you'd like, I can forward this email to you so you can address the concerns. I'm guessing you know who this person is.
Yes.
Thank you.
Thank you. And I can address some of those for sure. As far as the bus and the traffic pattern in and out, that was a concern for us. In fact, yesterday we were over there with one of our big school buses, and it was pretty obvious that the school bus is not going to work. So we've decided that we will not. We do pick up some of our clients with a school bus. Most of them are paratransit buses. So we're not going to use a school bus in that location. It just won't work. Too long to get turned around. We are going to use the paratransit buses, so that will be taken care of that way. Outdoors is a good question. There are natural windows or natural light windows, but the other issue there that folks they probably know this, but we frequently take our ADS folks outside the building. We take them on trips, we take them places, events and so forth. It's not enough to just stay in the building all the time. So we have scheduled trips that we regularly take all of our ADS folks out. So that's really not an issue in terms of getting outside versus being cooped up in a little small space. The private space, we do have 3 bathrooms in there. The ones upstairs are ADA. The one downstairs, which will be limited to clients who are mobile, who can walk up and down the stairs, that is not ADA, but it's suitable for our mobile clients. But the ADA and the handicap access, that's available upstairs. So that's not an issue. We will have a changing space upstairs, separate from the bathrooms, and that will be partitioned off. That's the way we do it now. And that's for folks that maybe have incontinence problem, during the day, and maybe somebody's already in the bathroom, so we take them to a special walled off or partitioned off so we can change their clothes. And so that's all set up. And their ADS are used to dealing with those issues. They're setting that up. The other question on open visibility, what was that one again? On visibility, was that the parking or?
Yeah, the open visibility, will the space allow staff to be able to easily
Yeah,
monitor
yeah.
all clients?
Okay. Yeah, well, we've been there, so, it pretty much is all open space. There are 2 offices, one's a conference room, one's an office, so there is private space there too for any client that would need counseled, in private. So we're pretty sure that we've got all our bases covered. And this is actually going to be a much better space than where they are now over at the campus, because they're in a temporary space with a lot of small meeting rooms. It's just not conducive. But that clubhouse is going to be ideal, the way it's set up. So, and I'll respond to those folks if you'll send me that email. Be happy to do that. Other questions on anything with ADS? You want to jump in?
Yeah,
Okay, doesn't sound like there's any other questions. Thank you, Supervisor Covelli, for asking those questions, because I think this provided a lot of clarity about what this move is going to look like. And from what I hear, I think it's going to be a big upgrade for this program, so it's really exciting. Is there anything else, Mort, that you wanted to address regarding programs and operations?
No, we're middle of a lot of changes, including a new managing director we hope to have on board soon. And then I think you'll start to see some changes that are happening at North Central, all for the good,
Great.
all for the good.
Thank you guys so much. Moving on to item 8, next meeting time, location announcements, and agenda items. 8A, committee members are asked to bring ideas for future discussion. 8B, next scheduled meeting is Wednesday, November 30th, 2022 at 3 p.m. And that brings us to item 9, adjournment. Do I have a motion? Motion by Covelli, second by Niemeyer. All those in favor say aye. Aye.
Aye.
There are none opposed. We are adjourned. Thank you all.